Welcome to this educational program.
This module discusses the causes and effects, or pathopsychology, of acute coronary syndrome, a collection of conditions resulting from heart disease. There are other modules available that describe the risk factors, diagnosis, and treatment of acute coronary syndrome in greater detail. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. The circulatory system, also called the cardiovascular system, contains the heart and blood vessels, the veins, arteries, and capillaries. Veins transport blood that is low in oxygen to the lungs and heart. Arteries transport blood high in oxygen away from the lungs and heart to the rest of the body. And capillaries deliver the oxygen and nutrients to the body's individual cells. Blood is forced through the circulatory system by the pumping action of the heart. Merely the size of a fist, the heart beats about 100,000 times and pumps nearly 7,500 liters of blood around the body in a single day. The heart muscle itself requires a plentiful supply of oxygenated blood, which is provided through a network of vessels called the coronary arteries. Coronary artery disease occurs when one or more of the coronary arteries become obstructed enough to prevent sufficient blood flow and therefore oxygen supply from reaching the heart muscle. This oxygen deprivation is called ischemia, which can often be felt as chest pain or discomfort, a symptom called angina. Over time, deprived of enough oxygen, areas of the heart muscle can actually die. Death of heart tissue is called myocardial infarction, literally heart muscle death, which is commonly known as heart attack. The coronary arteries become obstructed through a process called atherosclerosis, a slow, complex hardening and narrowing of the arteries that progresses with age and may start as early as childhood. As well as the coronary arteries, atherosclerosis can affect the arteries of the brain, kidneys, arms, and legs, causing serious complications and disease. Though the exact cause of atherosclerosis is unknown, it is thought to begin with damage to the innermost layer of an artery, resulting in a buildup of substances in the artery called a plaque. Research suggests that most of us already harbor some form of atherosclerotic plaque, and though a small amount of plaque in the coronary arteries will initially allow enough blood flow to the heart to meet the heart's demand, the arteries will start to narrow and diminish in elasticity as the plaque builds up. Over time, the plaque can actually rupture and expose a surface upon which a blood clot can form. Obstruction of the artery from this blood clot can lead to unstable angina, which is unpredictable sudden chest pain, or to two kinds of heart attack, called non-ST elevated myocardial infarction, or NSTEMI, and ST elevated myocardial infarction, or STEMI. Because unstable angina and both types of myocardial infarction are precipitated by plaque rupture and clot formation, they are lumped into one umbrella term called acute coronary syndrome, or ACS. They therefore have a similar cause, or pathopsychology, that begins with atherosclerosis. The next few slides discuss the process of atherosclerosis in greater detail. Lining the inside of arteries is a membrane called the endothelium, a layer of thin, flat cells. The endothelium forms a barrier between the blood and the artery wall, and its structure and integrity is fundamental to the health of the artery. Not only does the endothelium prevent toxic, blood-borne substances from penetrating the artery wall, it also controls the widening and constricting of the artery, some cell growth, blood clot formation, and inflammation, the body's protective response to injury. Endothelial dysfunction, therefore, is a disturbance in any of these functions, and it initiates a sequence of events that promotes and worsens atherosclerosis. While endothelial dysfunction occurs naturally to some degree in all individuals, it is aggravated by risk factors for heart coronary disease. Endothelial dysfunction begins with damage to the endothelium, which may be triggered by a variety of conditions, including high blood cholesterol, high blood pressure, smoking, immune injury, obesity, and diabetes. Damage to the endothelium allows various material not normally allowed through, such as LDL or bad cholesterol, to penetrate the endothelial lining. It also promotes thrombosis or clot formation, inflammation, atherosclerosis, and vasoconstriction, which is the abnormal tendency for the arteries to constrict or tighten. This invasion of material into the endothelial lining induces a complex sequence of events known as inflammatory response. With an inflammatory response, the blood vessels dilate or open up, there is an influx of fluid and many specialized cells into the area of damage. The clotting of blood is induced, certain enzymes are released, and reactive forms of oxygen and nitrogen, also called free radicals, are released. Although it is the body's normal defensive response to injury or invasion, inflammation can often unfortunately cause damage to healthy tissue. Indeed, the inflammatory response and tissue damage from inflammation are central to the worsening of endothelial dysfunction and the progression of atherosclerosis. Inflammation promotes abnormal migration of various cells into the endothelium. It encourages the buildup of lipids underneath the endothelium. It can damage the walls of the artery, and it can even degrade the protective cap formed over a plaque, making the plaque weak and susceptible to rupture. The next few slides discuss the process of actual plaque formation. The first step in the development of an arterial plaque is the formation of a fatty streak. Once LDL cholesterol has penetrated the endothelial lining, it undergoes a chemical change, oxidization. Oxidized LDL results in the release of proteins called cytokines that lead to inflammation. Cytokines make the artery wall sticky, which attracts immune system cells circulating in the blood, called monocytes. Monocytes penetrate the endothelium and mature into scavenger macrophages. These macrophages accumulate massive amounts of fat droplets, oxidize LDL cholesterol, and transform into foam cells. The foam cells build up underneath the endothelium, forming what's called a fatty streak. Other cells, called smooth muscle cells, then move into the area. They start to accumulate cholesterol molecules themselves and also become foam cells. Not only do they add to the existing fatty streak, creating a more complex plaque, but they also secrete proteins that form a wall around the plaque, called a fibrous cap. Though the growing plaque initially expands the artery outward, it eventually starts to extend inward, causing narrowing of the artery and sometimes symptoms of chest pain. Interestingly, much of the atherosclerosis process, including the breakdown of the endothelial layer and the formation of foam cells, fatty streak, and plaque, shows no symptoms at all. It is not until a thick plaque forms, embedded in a fibrous cap, that the first warning sign of heart disease appears, chest pain or discomfort. By that stage, plaque rupture and blood clot formation are indefinitely possible and are the dangerous events leading to the quite serious conditions of acute coronary syndrome, unstable angina, and myocardial infarction. Though the factors leading to plaque rupture and subsequent clot formation are not completely understood, it is thought that the composition of some plaque seems to make it particularly vulnerable to rupture. Plaque lesions prone to rupture generally have a high content of lipid, or fat, and necrotic, meaning dead debris, as well as a thin fibrous cap. Events such as intense activity or psychological stress may trigger the initial plaque disruption. In cells around the plaque, activated macrophages contribute to plaque rupture by releasing enzymes that destroy the fibrous cap. Finally, inflammation combined with other stresses, such as high blood pressure, a shear stress, can cause the thin covering over the plaque to crack and bleed. As the protective fibrous cap breaks down, it exposes the underlying plaque to the blood. Inflammatory cells circulating in the blood find the exposed plaque and trigger a series of events that culminates in the formation of a blood clot. This blood clot can partially occlude the artery and result in diminished blood flow to the heart muscle, which manifests as an unstable angina. It can also partially occlude the artery, but result in heart tissue death, which manifests as a non-ST elevated myocardial infarction, or NSTEMI. Finally, it can completely occlude the artery and result in heart tissue death, which manifests as an ST elevated myocardial infarction, or STEMI. To summarize, the three conditions of acute coronary syndrome, unstable angina, NSTEMI, and STEMI, begin with atherosclerosis, the slow, complex hardening and narrowing of the arteries. Atherosclerosis leads to coronary artery disease, the condition whereby the heart muscle does not receive sufficient blood flow and oxygen supply. It is thought that atherosclerosis begins with damage to the inner lining of the arteries, the endothelium, resulting in endothelial dysfunction and the process of arterial plaque formation and inflammation. Therefore, an individual will experience unstable angina, and STEMI or STEMI, depending on the extent of the blood clot formation, whether or not the blood flow in a coronary artery is partially or completely blocked by clot formation or vessel constriction, and the degree of damage to the heart muscle, whether or not any heart muscle tissue actually dies. The blood clot can partially or completely occlude the coronary artery and can lead to unstable angina, chest pain as a result of insufficient oxygen to the heart, or either type of myocardial infarction, heart attack, in which case actual heart tissue death has occurred. Other modules in the series include understanding acute coronary syndrome, reducing risk of acute coronary syndrome, and the management and treatment of acute coronary syndrome. Here are just a few of the many resources available to educate you on the heart. These references were also used to assist in preparing this presentation. We sincerely hope that this module has furthered your understanding of the pathopsychology of acute coronary syndrome.
We wish you the best for the future, and thank you once again for viewing this educational program. Welcome to this educational program.
This module discusses the causes and effects, or pathopsychology, of acute coronary syndrome. A collection, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. The circulatory system, also called the cardiovascular system, contains the heart and blood vessels of conditions resulting from heart disease. There are other modules available that describe the risk factors, diagnosis, and treatment of acute coronary syndrome in greater detail. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. This program is strictly informational in nature and by the pumping action of the heart. Merely the size of a fist, the heart beats about 100,000 times and pumps nearly 7,500 liters of blood around the body in a single day. The heart muscle itself requires a plentiful supply of oxygenated blood, which is provided through the veins, arteries, and capillaries. Veins transport blood that is low in oxygen to the lungs and heart. Arteries transport blood high in oxygen away from the lungs and heart to the rest of the body. And capillaries deliver the oxygen and nutrients to the body's individual cells. Blood is forced through the circulatory system